so much for having me, and I'm watching the chat. I see all the good mornings and welcomes, and this is such a very cool experience for me. This, I actually didn't know that pre-medical students were doing this, and I absolutely commend you. I think this is super cool, especially getting ready and preparing for a medical career during a pandemic. I'm sure has so many added boundaries and limitations, and you guys are breaking through those. So thank you so much for being here. I am going to share some slides with you this morning and chat with you a little bit about, not completely about allergy and immunology, but about my career in general. I've had a very winding and serendipitous career course up to now, and I've learned a lot of things along the way. So I thought what might be very helpful and beneficial is just to kind of get a bigger picture of all of the different things where you can find success and how to kind of design and develop the career that brings you the most fulfillment in your life. So without further ado, I am going to get started with sharing some slides with you. So hang tight for me just a second, and we're going to roll through this. Okay. Can everybody give me a quick thumbs up, moderators, if you guys can see my screen? Good. Okay, perfect. So this is a little, just some brief slides that I put together to really kind of go through some of the lessons that I've learned throughout my career and some of the really important behaviors and tips that you can apply to really help you to find success in your careers or in your future careers in medicine. Let me see if I can figure out how to advance my slide. There we go. Okay. So I know you guys are all coming from all over the place, all over the US, and I saw there's some, I saw somebody from Puerto Rico, and I'm sure there's people from literally all over the place. So this picture that I have on my screen is a picture of the hairpin turns that are present on the Beartooth Highway, which is a road that goes from Red Lodge, Montana, all the way, hi buddy, all the way to the western gate of Yellowstone National Park. And last summer, during the pandemic, my family took a vacation. We drove from Northern Virginia, where we live, all the way out to Montana, and spent some time kind of, going to different national parks and getting outside and doing a lot of hiking. And it was a great socially distanced vacation. But part of our trip took us across this Beartooth Highway, and it is a crazy, crazy drive that you can only do in the summertime. In the wintertime, the road is closed because of danger with, snow and ice and rock slides and all sorts of things. So the reason why I have this picture up here is because some of the twists and turns that you'll see in the Beartooth Highway are extremely representative of some of the challenges and twists and turns that I have found in my career in medicine. And so we're going to kind of use this journey as our guide to go through some of these very important behaviors to help you, or tips that I've learned that can help you to find success in your future careers in medicine. So first, I'll just give you a little background about who I am, or maybe who did I want to be. I am the youngest child in my family. I have one older brother, and I come from a long line of business people, but nobody in my family was in medicine. So I didn't really have any specific individuals that I could look up to say, I want to go into medicine like such and such. It just felt like it was sort of a calling for me. My earliest role models were certainly my parents, and my father, for as long as I've been alive, has been a small business owner. And he's a CPA, and since the beginning of time, he instilled these values in me to work hard and to define the success that I wanted to achieve in my life and in my career. Excuse me. And that really included the desire to make myself self-sufficient. So I wanted to be able to, put the work in to design this career path that I didn't have to rely on anybody else, and I could really, be my own person no matter what the future looked like. But I had to put the work in, and I had to put that effort forward, but knowing that that big effort, excuse me, yields very big rewards. So I knew that going forward from the very early days. And from my starting point, I really knew that I didn't want to be an accountant. That was the basics for me. Like, my dad went to work, he worked late every day, he worked on the weekends through tax season. And every summer I remember he said, you know, Karen, I'm going to teach you accounting this summer. And I thought, I cannot wait to get out of here. Like, I have something else to do. So I knew I didn't want to be an accountant. But as I started to, you know, excel in high school with science and with math, I felt that a career in medicine was the direction that I wanted to go. High school was easy for me. There wasn't a whole lot of challenge. I kind of, you know, showed up, listened, paid attention, and got good grades without necessarily having to work super hard. But when I went to college and became a, you know, a focused student, you know, following a pre-medicine curriculum, I really found my first great challenge. And it didn't come easy to me. There were definitely challenges with some of the coursework. I had to, you know, work harder than I had ever worked to really try to absorb and learn material, organic chemistry, anatomy, physiology. These were things that were, you know, not simple, and I had to put a lot of hard work in. And, but I didn't find the greatest success in all of my coursework. You know, some things were easier, some things were harder. And I had a advisor who put a lot of doubt in me and said, you know, I think you may be going down the wrong career path. I don't know if medicine is for you. And while that could be discouraging and set a lot of people down, for me, that really lit a candle of desire. And that is a very empowering thing. So, you know, to embrace those naysayers, to embrace the roadblocks ahead of you, and to look at failures as a way to say, okay, this is a starting point, and now what am I going to do to overcome that? That was a very empowering concept for me. So, you know, I know there's a lot of discussion about, you know, is there really a bell curve, and do people really fall within a performance bell curve? And a lot of people think that there isn't, and think more about you know, the power law distribution with a long tail versus, you know, performers falling within this bell curve. But, you know, when we think about those in pre-medicine, we're really talking about, you know, people who are in the high achieving portion of the bell curve or that power law distribution. But as you move forward in your career, the bell curve starts to shift to the right. And then, you know, at some point, everybody in your bell curve are the high performers. And so, you know, that shifting bell curve continued forward for me into medical school when, oh, thank you so much, when, you know, everybody in my bell curve were high performers. And then it really starts to shake out of, you know, how do you fit into this? And, you know, where are the challenges for you? And how do you overcome those? This is what I felt like in medical school. Like, there were so many options of what you could do or where you might end up. And to me, it felt a little bit overwhelming as far as how do you decide what you want to do, or, you know, where the cookie crumbles for you. And, you know, I started to learn through my, I guess my third year doing, you know, clinical rotations, you know, what I liked and what I didn't like. And I felt very overwhelmed by the concept of primary care. And, you know, I felt like it was just too broad, and I knew I would have this desire at some point to specialize, but I didn't really know what. And so then I kind of started to narrow things down and say, okay, you know, do I belong in a, you know, a surgical specialty or a medical specialty? And, you know, too many hours of standing over the OR table, I kind of thought, okay, yeah, I need to not do this. This isn't for me. So for me, I ended up going down this little decision tree and determining that I wanted to pursue a career in some internal medicine subspecialty, but I still didn't know what. And I think that that's okay. You know, I don't think you need to necessarily come in and say, you know, I want to be a neuroradiologist, or I want to be an orthopedic hand surgeon. You know, you don't need to know that from the beginning by any means. And a lot of people do. A lot of people start medical school with this, you know, burning desire of, you know, what they wanted to do. In fact, my co-fellow, when I was in my allergy and immunology fellowship, she knew before she went to medical school she wanted to practice allergy and immunology. I didn't even know that was a specialty of internal medicine. Like, I had no idea. So, you know, it doesn't really, matter from an early time frame, where you end up seeing yourself, because again, this long and winding road is going to change paths and change directions so many times that I think getting stuck in this decision tree is unnecessary, right? You can just kind of acknowledge that there's a lot of options and move on. So my first behavior that I want to talk about is just start where you are. So this is the very beginning of the Beartooth Highway, which comes right out of Red Lodge, Montana. And this is where we started on this journey to Yellowstone Park. But starting where you are is very important. So whether that is, with a great sense of where you want to be going, or if that is with no idea, but, a big dream of doing something in medicine, that's okay. And you don't need to really have more of a specific direction from the very beginning, but you do need to be open-minded, and you do need to have that desire or that work ethic to learn and to progress. When I was a medical student, we always talked about that long proverbial tunnel, which was, the fact that from high school to undergraduate to medical school to internship to residency to fellowship to finally becoming an attending seemed like this very, very long and dark proverbial tunnel, but it's different than you think. And being at the other end of it now and being, in practice for, many years, what I realized looking back is that the light shines through the tunnel on all sides. Just like this tunnel here that, that you can see in this picture, you don't have to wait to get to the end of the tunnel to see the light coming through. And so the other thing too is that you need to recognize it may not be a straight tunnel, right? The tunnel itself may have a lot of winds and twists, and it's how you proceed through that journey that matters the most. The second lesson is that there's a big mountain ahead of you, but there's also other mountains that are behind this mountain. And so these mountains for me, coming out of medical school, were to, get selected for the internship and residency that I was hoping for, and really not only to, to get selected, but to succeed and to thrive in these learning environments. And so these mountains definitely can seem overwhelming. Internship, residency, fellowship, these are all overwhelming things when you think about them so, in such a big, grand way. But you have to take these small steps to move yourself forward through, all of the little, challenges that come ahead of you to really make it up and over these mountains. So it's important to map your journey and to have a sense of where you're going. So you can see here, this was my map of the Beartooth Highway. So I had like a mile by mile, this is what you need to do, and these are the milestones, and where you want to get to and what you want to observe at these places. So you want to know what's next for you, but you don't necessarily need to know your end destination. For me, I did not know when I was going into my internship and residency that I was going to end up in the career that I ended up. And I've had a very, varied experience in getting here, which I'll tell you a little bit about. So there's a lot of small victory points. And I think that is really important to recognize them and to achieve them one at a time. And that helps you to build confidence in your abilities and the belief that you can really meet any challenge that you set for yourself. So really seeking those end results becomes very unnecessary. And what you need to do to get there is to seek the knowledge and have that kind of toolkit of what you want to do to advance your career. For me, mapping my journey started with my specialty training, internal medicine. I actually did that through the military. I actually took a scholarship when I was in medical school to help me pay for my education, but that led me to serve our country in the Navy, which I stayed there for 10 years. And, when I was starting my, my military career in medicine, many of my colleagues from medical school were finishing their, internships and residencies and starting the career that they would be in indefinitely. But for me, these small victory points included a lot of variation because what we wanted to do was to move in the direction of always having something kind of to look forward to and a new adventure ahead. During my time in the military, which I ended up spending 10 years, I've had a lot of different experiences. After my training, I became part of the teaching faculty of a medical school. I've trained countless medical students and residents. And I did that all before I even went to fellowship. So I had a little bit of a unique aspect of my career in that I had some attending time before I went and continued training. And for me, that was a very valuable asset in that, you know, all of the other fellows whom I trained with during my time in fellowship went straight through their training. But I think, you know, having that experience of being out and, you know, making all of the decisions myself as an attending, that gave me a lot of confidence and belief when I was in fellowship to be able to find success there. And I think that was very recognized by my, you know, by my attendings and program director. After my military career, I guess I should say after my fellowship, I went on to continue some more time as a subspecialist in military medicine. And then after that, I came out into private practice where I was in a multi-specialty group for about 5 years. And then I actually opened my own practice. So I'm going to tell you a little bit more about that. But tracking your progress is important as you go. You're always going to get feedback in every portion of your journey in your career, and whether that is from an advisor, or if that's from a professor, or if that's from an attending or a program director, or if it's from your peers or even from your patients, that feedback really is the biggest factor to really catapult you forward to continue to grow and change as a doctor. It's very important to celebrate your wins as you go. So there's lots and lots of wins in the path to a medical career. There's diplomas, there are certificates, there are certifications, there are, you know, board exams and, you know, fellowship and all these things that you can obtain through your career. But celebrating all of them is an important part of getting to that, you know, destination of having that career that you dream of. This picture is my husband and I at one of the viewpoints on the Beartooth Highway, but we weren't even anywhere near the top yet, but, you know, we had made it that far. I couldn't drive up the road. I was really afraid. I don't have a terrible fear of heights, but I do have a fear of falling from high places. And I had to pull over and say, honey, you've got to drive. I can't do this. I'll hold the map, you know? And so he did the driving, and my kids were losing their minds, and we made it this far, and we parked and got out, and we had to reflect on that hard work. And so, you know, I think that that same thing holds true in medicine, that you have to reflect on what you've done to get to where you're going. You know, there are a lot of things that are hard, but getting through them and learning and succeeding, you have to be able to recognize where you came from to see where you were going. It generates confidence. And as you have that confidence, you can really start to shape your career in the direction that you want, because you know that you can do those hard things. And sharing your wins with others is essential, because it's that opportunity to express what you've been doing and to share and reflect that really helps to drive you. The unexpected will happen. Okay, so you guys, I'm sure, know this just as well as anyone else, you know, being pre-medicine in the time of a pandemic. This is a picture of my older son. And while it looks like he's sitting down in some dirt, it actually was a big patch of snow, which we didn't expect to find that as we went up and over this mountain. And you can see some of the snow in the background as well. So it was the middle of summer, yet we were finding snow. So I think when the unexpected happens, you do need to learn how to pivot. There are always going to be unforeseen circumstances, difficulties, and challenges that occur. And I found that in my career as well. And some of those difficulties included, you know, things like, for example, when I was in private practice in this multi-specialty group, you know, I was there as the only allergist immunologist, and from a clinical perspective was allowed a lot of autonomy to do whatever I felt was the right thing to help my patients. But there weren't a lot of things I could do to change the managerial portions of the practice, the oversight of administrative and nursing staff. And that led to a lot of difficulties in that, I really could see, this isn't the way that I would want to have things done, or this isn't the way that, my patients are going to benefit the most. But when you kind of start to see these things that maybe you thought going into it would be so great, and you get there and realize, it's not what you thought. It doesn't mean you're in the wrong place. It means that there's something to learn from it and to recognize that change is normal. Being flexible and resilient are two very important qualities that I think are important to have, not only at the time of the unexpected, but in every aspect of your career. Even for me now, as a brand new small business owner, having my own solo practice, there are a lot of things that happen on a daily basis that are different types of challenges that I need to overcome, or things that I need to troubleshoot, whether it's staffing, or if it's software, or if it's payroll, or things that, I never really had a good grasp on, aside from, just being a good doctor. Being flexible and resilient are really going to carry you through, so that way you don't feel burdened by the things that you can't control. And thinking outside of the box is always an important thing when you're learning how to pivot. And I think for the pandemic, starting, it's been a year since the COVID-19 pandemic has been going on. And a lot of doctors have really shifted their gears. We've embraced things like telemedicine, which, is a much, more virtual way to practice medicine. But during a crisis, that's a great way to continue to provide care. So, a lot of other doctors have shifted in the direction of, entrepreneurship and a, side gig or some secondary form of employment for them, whether, they're helping other people in coaching, or, creating a nonprofit or whatever. There's a lot of, so many things that people are doing to pivot during these, uncertain times. For me, my pivot was to decide to leave my employed position in private practice. There were a lot of things that were very challenging that I didn't like, as I had mentioned. And, at first, believe it or not, I kind of felt like, well, this is what I chose, and this is like my lot, and, I have to kind of just deal with it. And it really didn't occur to me for quite a long time that I might leave and do something else. But at the beginning of the pandemic, my employer cut down all of our physician schedules to part-time. Payroll was the biggest cost for him. And so by reducing our time at work would reduce his, economic burden during the pandemic. And so what seemed like a major disadvantage to go from a full-time schedule to a part-time position, it allowed me a lot of time to think about the direction my career was going and to make a big change. And for me, that change was to move in the direction of leaving this multi-specialty group and to open my own practice in the town where I live and to serve my local community. And so, I had these 2 days a week now where I used to be at work and fully booked with patients to take the time I needed to figure it out. So, learning to pivot in the time of the unexpected for me has been the greatest, success in my career, and planning to, open this practice that, we've now been open about 6 weeks. So it might seem crazy to open a brand new practice during a pandemic, but it hasn't been. And, the thing is that the care that we provide for our patients is still needed. And so in doing things in the way I have, I was able to open a practice with a list of 350 patients who had, asked for appointments before we even opened. And within the first week, we had, already scheduled out about 270 patients. And so it's been growing exponentially. And that growth is essentially due to some of these things that I've learned in my opportunity to address the unexpected. So again, you can't be afraid to change your direction. The path to a successful career is not a straight line. And, in this picture, you can really see one of these, hairpin turns. And you may turn completely around in your career, but you have to remember that the career that you're designing is only part of your life. And it's hard when you're in that time in pre-medicine where you think about like, well, what kind of doctor do I want to be? And you think about practicing medicine for, decades. You have to, recognize that your life is going to change as as you get older and maybe move to a new place or meet different people or your family grows. And your career, it's just part of that. Your career is not all of that. So you do have to, in choosing what you want to do, you have to like what you learn. Thinking about specialties, as I had mentioned earlier, when I decided to go into internal medicine, I did that because I knew there was a lot of opportunity to choose something. I didn't know what that something was going to be, but I knew it was going to not be general internal medicine. And it was sort of my path to determining, where I thought I wanted to be. Interestingly, I thought that I was going to be a cardiologist, and for several years I did cardiology research and was very respected within the division of cardiology in the hospital where I worked. And they were very excited about, the thought of me applying for fellowship, and they wanted to bring me on. But, there's a lot of challenges. And when we talk about the unexpected, I really had some challenges in my second year of residency, where I was working, felt like I was working all the time, whether it was in the ICU or the CCU, or if I was working, doing night admissions. And there were just, the patients were really, really sick, and it was a big emotional drain. And at that time, a good friend of mine who was a couple of years ahead of me in training, she was a first-year cardiology fellow at the time that I was a second-year resident. And she and I sat down and chatted about, some of the stressors and some of these unforeseen challenges we were expecting, or we were experiencing, excuse me. And I really didn't see that she thought her career situation was going to get better. And I thought to myself, what if it doesn't get better, right? Like, do you really want to have this be your life? And so as I started to kind of second guess myself and say, maybe there's something else, maybe this isn't the direction that I want to be going. That time in my residency training coincided with a 2-week rotation in allergy and clinical immunology, which again, I had no idea was a specialty of internal medicine. And it wasn't in the hospital, it was at an outlying site. And I showed up and everybody was happy, and everybody was really enjoying the difference they were making in their patients' lives, and really seeing a dramatic, change in quality of life of patients who suffered, from, unrelenting symptoms of allergies, of recurrent infections. And, the trajectory of those patients' lives were tremendously changing. And I thought, gosh, like, that is awesome. Like, I really love that. And I enjoyed getting to see pediatric patients, which of course, as an internist, I hadn't seen pediatrics since I was a medical student. And I thought, well, I could never really see myself being a general pediatrician, but seeing pediatric patients in a limited scope, I thought was something that I could, I definitely could.
Dr. Kaufman, I think you're muted.
Okay, can you hear me now? I'm sorry
yes,
about that.
It was just for a second. So
yeah,
no
I think
worries.
it happened during the poll. I apologize. Okay, let me go back here. Okay, are we good? Can you hear me?
Yeah.
Yes. Okay. Anyways, I'm losing my train of thought. I apologize. But I guess the next thought is that, to me, it's very important that you protect yourself from burnout. Burnout is a major problem that physicians in the middle part of their career are experiencing. I see it all the time. I see it all around me, from colleagues to, friends, to individuals who are in various, physician groups that I'm in on social media. And I think that, as long as you really feel that absolute enjoyment and that fulfillment from what you're doing and what you're learning, that's a big way to protect yourself from burnout, because you're going to be learning it for the rest of your career, and it never stops. So you have to like what you learn, and you have to take steps in the direction of finding that career that fulfills you. Enjoying the journey is probably the most important thing. So, you have to remember that getting to where you want to be in your career, and for me, that was, having my own practice and building the practice that patients just wanted to come to because they knew that not only would they get the right medical care, but they were going to have the experience that they really desired. To me, getting to this point in my career, it's not all about this destination, but it's about enjoying the journey as you go. So, for me, that took me through, 10 years of military service. And, it took me through academics where I was, working as an assistant professor, and I was training, lots of people in medical education. But also, I went through private practice and have experienced so many nuances that I didn't anticipate. And then have, all of those things that have led me to here. So enjoying that journey, I think, is really, going to be so important in your career. And I hope that, as you progress through the rest of your pre-medical education and start to decide the directions that you want to go, that you do take time to reflect and enjoy it on the way. So the last thing I'll leave you with is one of my favorite quotes from Arthur Ashe, which is, success is a journey, not a destination. And it's just a wonderful experience to be in medicine. And here you can see my husband and I at the summit before we winded down the other side of the mountain. So I am going to stop my screen share and open it up to the chat. And whoops, I didn't mean to do that. Hold on, stop sharing. And take a look through so I can start to answer some questions.
Hi, thank you, Dr. Kaufman. This was awesome. We definitely need this advice, especially in this current situation that we all find ourselves in. So thank you so much. One of the more common questions that people had was about your military service.
Sure.
And just asking like pros and cons of was it the HPSPs?
HPSP, yeah.
Okay, so some people were wondering like pros and cons, why you ultimately chose to take it.
It's a good question. And I think that's such a big part of my career as my time in the military. I'll tell you a quick story. So when I was an undergraduate, I went to Penn State University. So if we have any Nittany Lions here, we are. I went to Penn State, and when I was in college and decided I wanted to go to medical school, I had a conversation with my parents about it, and they basically said, that's a great idea. Now it's time for you to figure out how you're going to pay for it. And I said, okay, the thought of, student loans is extremely daunting. And I said to myself that I needed to kind of figure something out and look into different options. I stumbled across the Navy recruiting office, which was right down the hall from a business that I'd worked for. I did note taking as a side job when I was in college. And I happened to walk past and I thought, okay, I'm going to go in and check it out and get some information. And I was really excited about, some of the opportunities to kind of, join the Navy, see the world, to, have humanitarian medicine be part of my experience and opportunity. And so I applied, and I actually got waitlist. No, that's not true. I applied and I got rejected. That's kind of how it started. So I had a prior sports injury. I tore my ACL in a skiing accident. And even after coming back from that injury and being a competitive athlete, at that time, it was really hard to get a military scholarship for medical school. And, they said, well, you're not physically qualified. So, I had to get a waiver, and they said, no. And I thought, what do you mean, no? Like, what? I'm a competitive athlete. Like, how am I not physically qualified to be in the military? I thought, this is crazy. So I asked the recruiter, well, what can I do? What do I do about this? And he said, well, there's really not much you can do. In the history of the Health Profession Scholarship Program, they've never overturned a decision. So, I don't want you to get your hopes up, but you really need to start a congressional investigation into why you were rejected. And I thought, oh my gosh, these are really big words. And I think at the time I was 21 years old, maybe I was 20 or 21 years old, something like that. And I thought, okay, I can do this, you know? So, so I wrote a letter to my congressman. I wrote a letter to my senator. I had my orthopedic surgeon, you know, submit information on my behalf. And I put a package together and I crossed my fingers and I took out loans and went to medical school. And this was in the summer of 2000, okay? And I started medical school. No, sorry, it was in the summer of 2001. I started medical school and my recruiter called me. It was probably a few weeks in, and he said, I have great news for you. For the first time in the history of the scholarship, you know, they've overturned their decision. And I was like, this is great, you know, now what? And he's like, well, you're on the wait list. And I was like, what? Like, what does that mean to be on the wait list? And he said, well, like, I don't know, X number of medical students have to like drop out in order for you to get a 4-year scholarship. And I was like, well, how's that gonna happen? Like, we just started. Who's dropping out now? You know, it takes so long to get here. You know, I know it's not for everyone, but they're not gonna wash out in the first couple of weeks. And he said, well, hang tight. You know, we'll see what happens with the new fiscal year, which the, you know, military fiscal year starts in October. So then 9/11 happened. And at that time there was an overwhelming desire to really just serve your country and or to do something. And everybody felt it. And so at that point, more than ever, I was like, I have to get the scholarship. Like, this is the only thing that I want to do. And so then October 1st rolled around and he called me and said, you know, congratulations, we're going to offer you the first 3-year scholarship of the new fiscal year. So I had taken out loans for my first year and I got the opportunity to have this scholarship opportunity to pay for my second, third, and fourth year of medical school. And that started 10 years that I ended up spending on active duty. And it was fabulous. The experiences in training were amazing. My residency program, I felt like I was the lucky one to get to experience just so much very cool medicine, you know, patients with, you know, rare diseases that we would see in the US, but they were, you know, getting them in the Middle East and getting sent back. And we were seeing all sorts of really cool stuff. And it was just a wonderful experience for learning. And so I loved it. So I spent 10 years in the military. I decided to get out and resign my commission after, you know, my husband and I had our 2 children. My husband is a pilot. My husband was Navy also. He's a Navy pilot and now works for the airline industry. And, you know, I didn't have a good plan for what we were going to do with our kids when I would get deployed and, you know, he would go to work. And so at that time, I decided that I would get out. So yeah, so that's kind of the story of it's a good story of getting into the Navy, at least. And the time I spent there was very valuable.
Yes, thank you. It's super inspiring, and a lot of people are kind of wondering, like, loans are really daunting, and so
Very
a lot of
daunting.
people are just in unfortunate situations having to pick. So thank you for sharing that piece of advice with us. There are also a lot of questions about starting your own practice and kind of like the business aspect. You know, medical schools don't have any formal business training, and
that's
so
exactly right.
do you think that you would have benefited from like an MBA or just a business class in general, or kind of like how you've been doing your private practice, like what resources you used?
So that's a great question. There are 0, you know, courses in business in medical school. And to be honest with you, I really thought that, you know, people who had their own practice, like that kind of in my mind was like that, you know, country doc somewhere who like saw everyone in the town, like Doc Hollywood is this old movie from the, oh, probably a long time before all you guys were born. But anyways, so, you know, I thought about it being like this country doc or something. And, you know, as an allergist immunologist, you know, I don't need to share call with anybody. My call is pretty, you know, minimal. You know, sometimes I get an after hours call, but rarely. And I don't need to be affiliated with a hospital. You know, I don't need to work overnight. And so, you know, I kind of realized when I was a fellow that, you know, having your own practice was totally doable. There was a doctor who was a year ahead of me. She was the senior fellow when I was a junior. And she was going to do it right out of fellowship, start her own practice. And I thought, oh my gosh, like I totally want to do that. You know, I want to have a practice in the town where I work, where I live, and serve my community. And from then on, that was kind of the long-term goal. But when I decided to do it, I really didn't know anything at all about what to do. In fact, I almost, I thought about starting a practice right when I got out of the military. And at that time, I had no idea what I was doing. I mean, I didn't know where I wanted to live. I didn't know, oh shoot, hold on a second. I am getting this, your computer's gonna restart in 59 seconds to install updates. So hopefully it doesn't. If it does, I'm gonna hop back on the Zoom on my phone. So hopefully it doesn't do that. I'm gonna try and figure that out. Anyways, so what I decided to do, whoops, hold on a second. I don't wanna do this, please stop. Okay, well, I'll troubleshoot while I'm chatting, sorry. So I realized that that was a thing, and I didn't know what to do. So I decided just to go into group practice at that point. And a second. Oh, what's going on? Sorry. So now at the time, now I'm going to open my own practice. I decided to hire a business coach and to kind of absorb information from everybody else who was already doing it. There's no reason to reinvent a wheel that's already rolling. So find somebody who wants to, you know, who's doing what you want to do, and then learn from them, right? So I don't think it's necessary to get an MBA. You know, having another degree, you know, is not going to really help anything. You just need to learn what you need to learn. You need to learn the information. So, you know, I definitely find that reaching out to others who have done it has been extremely helpful. You know, picking their brains, learning what they're doing. And then, you know, when I started working with a business coach, my business coach is another physician who has her own practice, you know, so, you know, she's been doing it 10 years longer than me. So, you know, she's already attended the School of Hard Knocks. Like, why do I have to go there? You know? So I kind of just start, you know, learning from what she's doing and, you know, following the example of learning how to, you know, how to market my business. That's a big thing. Like, you know, in the olden days, people just thought they would like hang a shingle and patients would show up. But that's not true. You know, patients don't even know you're out there unless you tell them that you're out there. So you really have that obligation to your future patients to tell them, you know, I'm here and I can help you, and this is why, you know, you need to come and see me. So so I've learned a lot about that stuff, and it's helped me tremendously to develop success in the business aspects of medicine that I really didn't know a whole lot about beforehand. I think I fixed my computer problem, by the way.
So great, thank you for sharing that.
Sure.
Someone was actually asking if your dad was able to provide any insight as a CPA to help you out.
I think yes, and I think he's actually, you know, even just more so as a small business owner. You know, there are, you know, the business aspects of having a practice are very daunting. There's, you know, there's a lot of balancing of, you know, what's going out before stuff starts coming in. So yeah, I think he's been tremendously helpful. In fact, I've leaned on my family quite a bit. My dad helps me with some of the, you know, business stuff and all the, you know, government forms and the taxes and all of that. My mom actually is a retired certified payroll professional. So she's been helping me out with, you know, getting all of my payroll stuff set up and making sure all of that stuff is correct. So yeah, I mean, I definitely lean on people. These aren't things that I'm an expert in. You know, I'm an expert in medicine, but some of these business things are new challenges to learn. And so, yeah, I definitely think, you know, if you've got, you know, a little circle of people that you can kind of lean to, or, you know that this is my friend who's an expert in this, and when I need questions about this, that's who I go to, or whatever. And to kind of have your little community set up, I think is really important.
Yeah, that's awesome. And also great news for me because my best friend's getting her CPA. So
there you go.
So we definitely also had a lot of questions just asking about if being a DO has impacted or made a difference in how you practice medicine.
I think it has. I think all of this stuff in my career has made a difference in how I practice medicine, to be honest with you. But I will tell you, you know, I know many MDs who practice how I do. I know many MDs and DOs who don't practice how I do. So, you know, I think, you know, the osteopathic philosophy is really, you know, kind of embracing people as a whole, and to really kind of, you know, keep that kind of mind body concept, you know, as you treat disease. But to be honest with you, you know, patients want to go see a doctor who's going to listen to them and who's going to hear what they have to say and to really understand their complaints. And so, you know, for the doctor who's in and out of the room in 5 minutes, their patients aren't going to have that experience. So, you know, you do need to be able to take some time, and you do need to kind of engage them so they know that you hear them and you hear their complaints. And I think that that's one of the biggest attributes to my success in my career is just being a good listener. And that doesn't come from a degree, you know, that comes from learning and to reflect. And so I think patients know that when they come to see me. It's interesting, you know, my medical assistant goes in first. She loves to take like a thorough history and comes out and tells me the whole story. And I'm kind of like, okay, I'm going to go ask them the same thing anyways. And it's not that, you know, I didn't like her version, but to the patients, you know, they want me to hear it. They want me to hear it. They want me to have that experience with them. So some people do seek me out because they find out that I'm a DO and they're like, oh, I really want to come and see you because you know, I know that you have this experience, but I don't know. I mean, I don't do osteopathic manipulation in my practice. So that's one thing that from an educational standpoint sets DOs and MDs apart, is that DOs will learn osteopathic manipulation and MDs do not. That's not a big part of my practice by any means. I haven't done it since I was in medical school. So so in that sense, I don't think it's that different. But you know, I think, you know, really having these experiences with patients and you know, connecting with them. Some people kind of tell me that I have almost a relationship with my patients more like a primary care provider does, which is funny to me because from the very beginning, I was like, I don't want to be in primary care. But, you know, I know my patients' families. I know all the things about them. They come to see me and they're like, how do you remember that? You just do. It's like, you wouldn't forget stuff about your friends, you know? And there's some families where I see, you know, 3 generations of the same family. I see the little kids, the parent, and then the grandparent. So, you know, to me, that brings a lot of fulfillment and a lot of enjoyment. I'm looking in the chat as well. I don't think there's any stigma to being a DO versus an MD whatsoever. I think you make your path. You know, it's just like anything, right? There's good lawyers and bad lawyers. There's good cops and bad cops. Like there's good doctors and there's doctors that aren't so good. So you just need to make yourself into a good doctor, and it doesn't matter what your degree is.
Great, thank you so much for answering that question. There was another question previously, kind of towards the beginning of the presentation, sure, asking about if you have to have like a separate fellowship or training to do pediatric allergy and immunology, or if that's something that you can practice as just a regular allergist and immunologist.
Yeah, so Allergy Immunology is a subspecialty fellowship that you can get to from either primary specialty of pediatrics or internal medicine. So you could do either and end up in the same fellowship, okay? Fellowships for allergy and clinical immunology are 2 years or 3 years. And it depends on if you want to have an extra year, usually for bench research. That's the 3rd year. So all of the fellowship programs are MedPeds fellowships. So, you know, you kind of will get the experience based on where you train. Some of, you know, allergy immunology as a whole is a very small specialty. And so the training programs are small. You know, they may only have a handful of fellows, you know, in total. They may graduate, you know, 1 fellow a year or a couple fellows a year or something like that. So when deciding on where you want to do your fellowship, you kind of have to also think about what kind of provider do you want to be. Like some centers are, you know, you go to Duke, you're going to be an expert in food allergy. You go to UVA, you're going to be an expert in venom. You know, you go to, you know, Scripps in California, you're going to be an NSAID allergy expert. So like, it depends on kind of where you go and based on who's training you. So, you know, I chose a program. I trained at LSU in New Orleans, and I chose a program that was very strong in the things that I was very weak in. You know, I was already attending in internal medicine. So dealing with adults with rhinitis and asthma, you know, that was bread and butter for me. But seeing pediatric patients or seeing patients with primary immune deficiency was so out of my wheelhouse that I thought, you know, that's where I really need to focus and to be a very well-rounded clinician. So I trained at LSU. LSU is probably 70, at the time, it was probably 70% pediatrics. My office was in Children's Hospital. we were a Jeffrey Modell Center for Primary Immune Deficiency. So we saw a ton of immune deficient patients. I didn't know anything about that. In fact, I didn't really even know how to talk to children at all. Like I didn't have kids yet. I really didn't have a strong pediatrics background. I kind of started talking to kids like I talk to puppies, you know. I was like, you know, where's your ball? Like, where's your nose? You know, so you kind of like, kind of learn as you go, but that comfort grew fast, and I started to really thrive in learning things that I didn't already know about and didn't feel comfortable with. So, you know, now in my own practice, I would guess probably I'm seeing, you know, maybe a quarter to a third of my patients are pediatrics. I definitely see an adult heavy practice, but it is very, very commonplace, you know, that I'll see an entire family, you know, like somebody will have something, one of the kids has something, and then, you know, the parent says, okay, well, I'm going to bring my other kid in to see you. And actually I need to see you too. And my husband is doing this. And like, we're just all making appointments. Like, okay, you know, so that's kind of, you know, one person kind of starts the wheel and rolling, and then, you know, everybody ends up coming in. So it's very cool. I love it. I absolutely enjoy seeing the babies. I love seeing the toddlers, the little kids. And I love seeing adult patients. So it's a perfect specialty for me because, you know, it's all, you know, kind of within this kind of specific area that I'm an expert. But it's a little bit different with kids and adults in all different age groups, which is really cool.
Great, thank you for answering that. And some people are really happy that you can see both. You don't have to really pick or choose one mainly. So we'll do one more question before we do a quick wrap-up question. People are asking how your practice has changed since COVID. You do like allergy tests, you're really in people's faces, and have you been able to do telemedicine, and kind of if you could talk about that?
Sure. So I think initially, you know, so my practice has turned around completely because when COVID started, I was an employed physician. I went from full-time to part-time. At first we were trying to do like all telemedicine, which was brand new to us. You know, we had no experience doing it before, but we were really trying to keep people out of the office and stuff like that. And then, you know, kind of started bringing people in, you know, bit by bit. You know, I was working part-time, and I ended up leaving in November, and I stayed home for the rest of 2020 to work on building this practice and everything. So when I opened my practice, I do see a majority of patients in the office now. I mean, people are very comfortable now wearing masks. You know, the world is starting to become vaccinated. You know, I wear an N95 still. I'm vaccinated. You know, myself and my staff were all vaccinated, but I still wear an N95 while I'm treating patients. They pretty much just take their masks off for a quick nose and oral cavity exam, and then it goes back on. So we do, you know, all the regular testing. One thing that I haven't done, and I haven't quite figured out how I'd like to do it, is I have not resumed doing spirometry. So, you know, a big part of what I do as an allergist immunologist is I do manage asthma, and, you know, we used to do so much spirometry that now I'm really basing my asthma management on, you know, clinical symptom management and how much people are using their, you know, relief inhaler and, you know, asthma control test scores and things like that, versus, you know, basing on the data of spirometry. So trying to figure out, you know, the best and the safest way to do that. And there's a lot of ideas kind of going around, but I haven't yet implemented spirometry. That's probably the biggest change. But other than that, I mean, allergies are going on, you know, and so with everything starting, you know, spring in Virginia, I don't know if any of our listeners are in Northern Virginia area, but the allergies here are a hot mess. And last year, you know, with the pandemic really shutting down everything starting in March, everybody put their, you know, their allergy symptoms on the back burner, and people really suffer tremendously from the symptoms of allergy. And the oh, I see someone's in McLean. Ooh, you can come see me. You know, the quality of life is terrible. And so to be able to fix that for people is such a gift. And patients know that, you know, this is their year to do all of that stuff. So in opening a new practice, you know, I'm absolutely busy. So a majority of my patients are in person. I still do. Telemedicine is really, you know, easy. And, you know, a lot of times, especially if we're doing like in my little pediatric patients, like lab follow-ups, you know, it's easier to do that with the parent at home, right? Like rather than them dragging their toddler in or something just to sit down and like, let's talk about your lab results. So, so that kind of stuff, I do a lot of telemedicine. We just kind of leave it, you know, the option up to the patients. Insurance still is, you know, paying for it in the same way they're paying for visits. So, you know, that's the business of medicine. As long as it makes sense, then we've got to do it. Yes, absolutely. Refer your patients to me for sure. I'm like watching the chat. This is great.
No, that's awesome that you get to integrate both in-person and telemedicine. That's a cool thing that's come out of the pandemic. We've heard from a lot of doctors, so thank you for sharing.
It's definitely cool. Yeah, you're welcome.
Yeah. So we'll end on this last question.
Sure.
As we are still in the pandemic and hopefully getting these vaccines quicker, do you have any advice for us as pre-med, pre-A, post-bac students, master students on our journey to healthcare, medicine during these interesting and different times?
You know, I would say if you desire to do it, don't let that desire wind down because things are challenging. You know, there's a lot of adversity out there, not only now, but there will be in the future, and it's just going to look a little bit different. But if you have that work ethic and you have that desire, you know, just know that you can do it. The future can include anything you want. It doesn't have to be one thing. I mean, look at my career. It certainly never included one thing. But you can kind of make those changes and you can kind of, you know, roll with it a little bit and to continue to create the career that you want. And if you change your mind and want to, you know, pivot later, then pivot later, you know. So I think, you know, if you guys want to do it, you guys are certainly expressing interest. You're here on a Saturday morning, you know, to listen to me talk. You know, I absolutely commend you. I think you guys are all the future of what we're going to see in medicine. You know, I think that, you know, if you remember that the patients are coming to see you, they want to get your expertise, but, you know, they choose you because of who you are, you know, be that person that they want to see, develop yourself into that kind of doctor, and you guys will all find success.
Thank you so much, Dr. Kaufman. I mean, you have the chat open so you can kind of see all the thank yous and all the kind words.
You guys are so awesome.
We really appreciate you being here. This was super inspiring, and we definitely need this uplifting talks during this time. So thank you so much for taking time out of your weekend and spending it with us this morning. We hope you have a great rest of your weekend, and we'll definitely stay in touch, and we'll go ahead and put your Instagram in the chat. If anyone has any like questions or just want to go follow Dr. Kaufman.
Absolutely. So feel free to send me a message, follow along. My website is kaufmanallergy.com, and we are located in Vienna, Virginia. And thank you all. I'm so happy to be here. This was great. I really enjoyed it.
Thank you so much. We'll definitely stay in touch with you, and have a great rest of your weekend.
You too. Thanks, guys.
Bye.